Good morning, everyone. Welcome to TeleShadowing. We're live on YouTube and recording this session. Please feel free to ask questions in the chat box as we go along, and they'll be addressed. I'm honored to introduce our mentor for today, Dr. Farooq. Dr. Farooq is the head of Outpatient Clinic at the Lower Bucks Hospital Residency Program in Pennsylvania. He's also the Outpatient Clinical Supervisor with the Nazareth Hospital Residency Program in Philadelphia. He has been named Philadelphia Magazine's top doctor in 2021. Now I'd like to request Dr. Farooq to begin today's session. Thank you.
Good morning, and everybody can hear me, hopefully.
Yes.
So, yes, that's great. Yeah. So thank you so much for a beautiful introduction. So thank you so much for doing this rotation. And I think this is a great job what you guys doing for the community and for the medical field and for everyone. So it's an honor to be here this morning. So I'm Dr. Umar Farooq. I practice internal medicine. I am from Pennsylvania, Bensalem. There's a suburb of Philadelphia. So I practice in Bensalem. And so today I'm going to talk about, I just have written, you see, Externship Program, but it's an externship program. It's not only the externship program, but I'm going to talk about other things as well. So that also include observership with us, and that also include high school and college students mentorship. And actually that's we do here. And we try to mentor anyone who comes to us. So that our mission is to give you atmosphere and you develop interest for the medical field. That is our mission. And for the graduates, our goal is to help them so they can get residency in the United States. We also have medical students. They're coming from overseas, also from here, United States. They do their elective with us. So. Right, next slide. All right, so I think everybody is interested to hear my story, of course. We all start with a story. So originally I'm from Pakistan, and I graduated in 1985, long time ago. Seems a long time ago. So I did my residency in Pakistan, and then I went to United Kingdom, England. So I was in England for a year and a half. So I did my specialization in chest medicine. Then I did 6 months of house job. Then after that, I got my green card. So I have to come to United States. So I came to United States in 1991. Then I did my residency in started residency in 1993, but before I started my residency, there's a little part of that one too. When you come to United States, so you are here new in this country, and of course, you have to do something for living as well. So I was lucky. I came to my sister lives here, so I was with her, but still, I was working with them, and my wife is also a physician, so. We were working with them at the candy store. So while we were getting ready for our exam, to pass our exam and to start residency. That was a beautiful transitional period. It sounds beautiful now because I passed my exam and I got residency. So that was like a great experience, like communication with the people, standing at the candy store. So not thought about that I'm going to do that in the United States. But that's the beauty of this country. So you can start from anywhere and you can go anywhere. So. Yeah, here's my family. Yeah, so I'm in the middle, center of attraction. So next to me is on both sides. I will start on my right side. So the tall guy, he's my son. Mohammed Farooq. He's the first year medical student right now. And next to him is my daughter, Miriam. And she has done her residency and she's working. And then myself, and next to that is my younger daughter, Sarah. Actually, Sarah didn't want to go to medical school. So probably I was not able to convince her. I don't know why, but she wanted to be in the computer, but that's perfectly fine with me. So next to that is my wife, Dr. Sabat Farooq. She's also internist. So we practice internal medicine. So this is my family. And actually my family, like my children, they motivated me to help other children. The way they went into the medical school, the struggle they have. So I am using what they did and teach other people. Actually, quite a few went to medical school. The students, the college students, they came to my office. I mentored them. They went to medical school. Actually, when there was a white coat ceremony, my son's white coat ceremony last year, so I was there, and one student came to me. I said, "Hey, Dr. Farooq, I'm your student." I said, my goodness, my student is here too. So that was like amazing, like when I was there and I saw my student starting medical school with my son. And so that was a beautiful feeling that I had. Next slide. Here is my mentor, my mother. So, my mother came in the United States actually 1 year before me. My sister lives here. And so your mother is your mentor, that I believe in. So my mother is my mentor, starting from beginning when I started my medical school, even at that time. So how did she help me and how did she support me? So actually she passed away 8 months ago. So last year in September, she was here in the United States. She was in the United States for almost 30 years. So I lost my best ally. So, mother is mother. No one can substitute mother. And next to that is my brother. So we are two brothers. Is my brother, and he's accountant. He's master and also master in business. So we are two brothers. So here he is. Okay, next slide. Okay, here is like my kingdom, my office. That is our headquarters. So you can see the picture on the left top. This is my office, and we also have the multiple specialties here. There's ophthalmology, there's a podiatry, there's a urogynecologist, and all that is family owned. So these ophthalmologists, they are my nephews, and the podiatry and urogynecologist. So that is another thing. When you work as a team with the family sport, so you can progress. So that is all happened because we were together, my family, and my nephew is ophthalmologist. Actually, they have a residency program. They have started ophthalmology residency program at Nazareth Hospital just last year. And so this is my office, this one, and this is like on this side is ophthalmology. Then this building looks small, but inside is very big. So then typical office, we have this our waiting room. Here's our exam room. And you can see my happy extern, my students. So they were rotating with me. So I think that they got residency, most of them. So this was last year picture. So next. So these are the hospital I'm associated with. So I'm head of outpatient clinical services for the residency program at Lower Bucks Hospital. And this is Lower Bucks Hospital. Then I'm also head of outpatient medical director, outpatient services for Jefferson Health System. And I'm also on faculty with Nazareth Hospital and St. Mary Hospital. So all these hospitals, they have their residency program. So some of my students, externs, they get residency in this program, and we give them letter of reference, and they get residency there. So last year we have almost like 40 externs rotated with us. So more than 30 got residency, and this year 35 rotated and 28 got residency. I'm very happy. And most of them get residency. The one who don't get residency, there's something like they have to improve or might be something with their scores, but we try to help everyone. Okay, what's our mission? Our mission is for these young doctors to learn about US healthcare system, strengthen your clinical skills and social skills, very important, and obtain residency in United States. So when these externs, or when these foreign medical graduates all over the world, when they come in this country, they're technically thrown in the ocean. So in the ocean, you have everything. You have sharks, they can eat you. And they're small fish, they're big fish. And also there is a boat as well. So we are the boat. So we can take them and we can help them. So we are their ship in the ocean. So we try to help them. So that's our mission, is to make them understand the health system of United States. And we give them hands-on training. They can do history, physical, and see the patient. And finally, we make plan together. So they get very good exposure. So on top of that, the communication skills, they're very important. So, and social skills, they're more important than anything. So when all these doctors come across the country, across the world, so they come from different kind of culture. And so when they're here in the United States, they have to learn the culture here in the United States, how to communicate with the people. And there's so many things we discuss and during the rotation. So we try to mentor them and make sure they learn all those skills. Because when you apply for the residency, your knowledge has been tested already by your exam. You have taken your exam. So knowledge was tested. But the most important thing is how you get along with the people. Are you a team player? Are you going to be contributing something in the program? Because they don't want anybody whose knowledge is good. If you have like very high score, that is very good. Somebody has very high score and social skills are not good, that person is no good. Someone has very good social skills and we know that's a team player and even their scores are a little low, that is much better. Because we can teach people, we can improve their knowledge, but we can't change the personality. So that is a very, very important point. So when all these foreign medical graduates come to United States, they have to run all these things. And that we try to teach them and we find out what issue they have and we try to help them. So here at Night Medical Associate, when they come, so we provide them like 4 weeks of rotation. It could be like for the extend, it could be like observership, it could be for medical student. They want to do rotation with us. So we provide them 1 month rotation. So as I said, that's with hands-on training. We give them hands-on training and they see the patient, they communicate, they talk, and they write down the plan and I finalize the plan. So we try to build confidence in our students. So because they have to see patient by themselves. So we try to build confidence. We provide them an atmosphere where they can learn. That's what we do. We have a conference room where I'm sitting right now. We do a lot of presentations here and group teaching. And then we also, we provide them electronic medical record access. I think now technology is so high. Everywhere is EMR is being used. But in certain countries, certain hospitals, when they come from, they have not exposed to EMR at all. So we provide them full access to the EMR. So, and they learn. And actually that helps them when they start their residency because they already understand the electronic medical record. And also we give them a hospital tour. I go to hospital, I do run. So I take them with me and they get exposed to United States health system. How does it work in the hospital? And I also go to the nursing home. So they go with me, go with me and see patients in the nursing home, and they're elderly patients. So they get concepts of the nursing home. A lot of people don't have a concept of nursing home because especially in Pakistan, when you talk about nursing home, so they're talking about kind of a hospital setting. So they provide care. But in the United States, nursing homes are a little bit different. So they call them skilled nursing facilities. So they are not only for the old people. People, when they come, my student, first thing they ask me, oh, this is for the old people. No, this is not for the old people. They call it skilled nursing facility. So there are two kind of people there. One, suppose somebody break their hip, so they need rehabilitation. So they could go to the skilled nursing facility and get rehabilitation for a few weeks, exercise, physical therapy, occupational therapy, and then they go home. So that is kind of a skilled part of the nursing home. So then they're outpatient. They can't go home now because somebody has a stroke, somebody has advanced dementia. So they cannot live by themselves at home and they need full-time care. So then family decides so they can stay in the nursing home. So those patients, so they stay in the nursing home. So that is their permanent residence. So that is kind of a concept of the nursing home in United States. But recently concept has changed even a little bit more. We went to a next level. Like in the nursing home, now the nursing home almost kind of a hospital level now. The whatever you can do on this medical floor, I'm not talking about the intensive care unit or telemetry, whatever you can do on just medical floor, you can do at the nursing home. So you don't have to send patient to the hospital. Patient needs intravenous antibiotic, we can give them. Patient needs IV fluid, we can give them. So this health system has changed a lot. So because patient used to go to the hospital, something happened, sent to the hospital. So, but now it is not like that. So it is, we try to keep patients in the nursing home, treat them there, and unless if we can't treat them, something really gets serious, then we send them to the hospital. So that is a brief concept of the nursing home. Population is growing in the United States, elderly people also. So we see a lot of elderly people. Of course, they go to the nursing home, but still we don't call them like elder house. So there are different levels that I can discuss sometime. What other levels of care in United States, like, of course, they come to office, then there is, if they can't take care of themselves at home, there's assisted living. And so there are different levels. Then the nursing home, so they can move to different levels. So that was a brief about the nursing home. Next slide. Yeah, as I said, like in 2021, we had 30 extern matched. So I was very pleased about, I think the 40 came. So some of them are like, some are out of 40, some of them were actually the medical student. They were just in the medical school. They were just doing their elective with us. So out of 40, I don't know how many were medical student, but 30 got residency here in the United States. And this year we have 29 extern, they got residency. I think we have almost around 40. So among them, they were medical students. You see pictures here at the top. They were matched last year. So they were in my office the day of the match. So they were so happy. So when you get matched in the residency program, your life is changed. You reached your goal. That is the ultimate goal, is get residency. You work so hard. You go to school for like 20 years, starting from like primary school. And so your final goal is to get residency. So once you get residency, so that is, you achieve your goal, your mission. Of course, after that, now you have to get training, but you're already in, and you have bright future in front of you. So the picture here there are multiple people standing. So on the front, they were the medical student. They came last year, and there are three medical students here, and rest of them were externs, and most of them got residency. Next. All right. So I just would like to talk about what are the expectation of the program directors when you apply for the residency. So they have some expectation, and I frequently talk to medical directors in different program because I am associated with them, different programs. So like people, I think first most important thing is the year of graduation. What year you graduated? So in general, like if you have less than 5 year graduation, then you have a good chance. But once you cross 5 year, then it's become a little bit difficult, because nowadays I'm getting like this graduates, they just graduated last year and they're applying for residency this year. So they're fresh out of the medical school. So when you have this kind of candidates, they have good score. So they're gonna prefer them. Like they prefer like fresh people. We prefer here fresh people because they have more. I know they can learn more. If somebody has already done so many qualification from other countries, I'm going to talk about that a little bit, that actually won't help. Somebody has done, suppose, like MRCP, like FCPS, like MD from India, or FCPS from Pakistan, MRCP from England. When they come here, they think they are very well qualified, but technically they are not, because they want fresh people, the one who can teach them. When the people come with so much qualification, it's hard to teach them because their mind is set already to certain things, and sometimes they create a problem as well in the program, and it happened actually. And last year, year before, one of my extern, he was MRCP from England, and I talked to the program director. He said, no, we can't take him because he's very well qualified, and we have issues with the qualified people. They don't listen, this and that. I said, okay, I can tell you, you're not going to have this problem. And I mentored that doctor, and he was very humble, and he was like already a specialist, he was cardiologist. Once he started residency, he was so humble, and he went through so good. Actually, they gave him one grace year. So normally the residency is 3 years. They said, okay, you can do it in 2 years. So he's now 3rd year right now. So he's doing it. So those are the things. Like, again, I'm talking about the attitude. Attitude is very important wherever you are in your life, regardless of medical field. That is the one that makes you different from other people. Arrogance won't work. Some people that think they like high score to 70s to 60s. So they get a little bit, oh, we have no problem, we're going to get interviewed. One of my extern has like a 266, something like that kind of score, and only got like 5 interviews. I thought this extern is going to get like 20 interviews, but that extern never asked me, because that extern has in mind that my score is like 260. I'm the top of the top. I should not have a problem, but not able to get that many interviews. So this is humbleness is very important. Make humbleness mission of your life. You will be successful. That is the key. And then is, as I said, what USMLE score matters. Like, of course, like first thing they look into the USMLE scores, and then also the attempts. If somebody has attempt, that's a little bit red flag. And then is like clinical experience. Clinical experience in the United States is very important. Regardless, you have a high score, but if you don't have clinical experience from United States, it's hard to get interviews, because people are telling me now, because of this COVID, the students were not able, doctors were not able to come here to do externship, and they have good scores like 260s, and they did not get interview because they did not have any experience from United States. So that's why I'm here, to give them that experience in my program. So personality, and I talk about personality and compatibility. That is very, very important. You have to have a team player. Sorry, when you go into the program, they want to run their program. They don't want to like talk to those doctor all the time. This thing is not right. This thing is not right. Or just like, and so they don't want. They just want the team player become the system runs smoothly, and they work rather than just correcting them. And especially their like personal issues, like issues with their colleagues. So compatibility and personality is very important. Residency is 3 years. So 3 years, just do residency 3 years. Like don't create any problem, any issue, anything happen, solve it between you, like with your colleagues, and don't make issue out of these things. And 3 years fly. The time flies very quickly. So I just have a little issue with some residents. I just talk to them, and I mentor them, like what they have to do during the, I mean, they have to correct themselves, and they understood. So this is the most important when they take interview during for the residency. So sorry, one thing we ask you, sorry, how do you take the criticism? That is very important. So you need to learn how to take criticism. So if you want to see somebody's real personality, just criticize them. The personality will come out. So I have seen myself that one too. So you should take positives, especially if your mentor is criticizing you, just take it positive. So because they want you to learn. So sometimes you feel like they're criticizing, but that is not the purpose. Purpose is that you learn those things and correct yourself and take it positively. So this is the main thing. If you want to be successful in your life, so you had to be compatible with other people, and you have to be a team player, and you have to be productive. You don't want to stop the flow. If you stop the flow, create some issue, everything is like, everybody go into problem. So these are the things you have to keep in mind. High score is very good, but your personality, your attitude comes before your scores. Your scores are going to just take you for the interview. Then after that, they're going to look at you like what kind of person you are, and you are compatible with them or not. So the next is like research. I think research is good. It's okay for I think if they're medical students, it's good for you to do it. And it's going to help you for the residency. But once, if you are graduated from the medical school and you are fresh graduate, then you have to concentrate on your USMLE. You need to get good score, and you need to have clinical experience. Don't go after the research. You're going to waste your time. So they consider research, but very minimal. Some program might consider research, but not. You're doing residency there. They're not getting a researcher who sit over their research. You have to take care of patients over there. So research is okay, but don't make it number one thing. If you want to apply for residency, your clinical experience is very good. But if you are a little older graduate and you want to show you are doing something, of course, research kicks in a little bit. You had to show improvement. So I did this, but don't too much emphasize on the research. You tell them, yes, you have done research, but don't make it like a big topic, because as I said, they need people to see patient in the hospital and do work and take care of patient, not sit and do research. Research is okay. Actually in the program, you have to do research. They give you a little project and you do research and doing your residency, and that is good enough. But if you want to do some specialty, then you can do research in those specialties even during your residency. So before residency, if you have done little research, that is good. But more important is your clinical experience, especially in United States. So you have to get experience from United States. Yeah, this is my favorite, extracurricular activities. So that you have to get involved. You have to have extracurricular activities. You just don't want to be a book smart. Everybody can be book smart, but you have to be a well-balanced person. So next slide. So this is my program. So this is my organization called RECAP, Reaching and Empowering Communities Across Pennsylvania. So under that umbrella, I do this my externship program, because my goal, the mission of this organization is, number one is education. I believe education is the key. Education is the power. So regardless whatever field you are in, so education is the power, and you all are getting higher education. You are, so that is very important. So without education, there's nothing. So our mission is to teach, tell everyone to get educated. How can we help them for their education, and how can we mentor them? So next mission is healthcare. So I think everybody should have a right to have a healthcare. So there should be, regardless whatever the income is, they should be getting healthcare. And the third step is the civic engagement. Civic engagement is very important. And I'm going to talk about that a little bit later, I guess, in my in this one. So about civic engagement when that topic comes. So what I do and what I expect you guys to do. And actually my externs, when they come here, they get a lot of exposure with these things I'm going to be talking in a little bit. And this program, what I'm doing, Nights Medical Externship Program, that undergoes umbrella of this RECAP, Reaching and Empowering Communities Across Pennsylvania, this organization. All right, so that's what we do. So the community work. When the COVID-19 started, we started our mission. So we're going to give vaccination. And so at that time, it was very difficult to get vaccination. I tried my every resource and I got vaccinations. So I want to give to the community, because this was a pandemic, and this is everybody should get this vaccination to protect themselves and protect other people. So we started. Like we got vaccination. I was so excited. Actually, this month is our anniversary for the vaccinations. We are 1 year. For last 1 year, we're doing vaccination, and we're doing at different places. We're doing at places of worship. We went to actually into a mall. The picture on the shopping center where I did written a free COVID-19. All my externs standing with me. So we went into outside the shopping center. We put our table there, and we asked people to get vaccination, and people came, and they got vaccination. And then of course we go to nursing homes. So we started over because they are the elderly people, they need vaccination. So we started. So all my students, they helped me, and they were part of, they are part of this mission. So every month we have 1 month rotation. Every month when they come, so they go with me, and we do this vaccination drive. Now we are just doing in the nursing home. And because now they also need the booster, so they got first and second dose, and second booster, maybe getting third booster. So that's my team, my externs, my college students, high school students. They all get involved. I think this is this kind of their community service, and they're learning from here, and hopefully they're going to keep on doing in future. So next slide. Yeah, this is we do healthcare day every year. So this organization called Apna. the American Pakistani Physician of North America. So this come under that umbrella. So there are like 20,000, more than 20,000 Pakistani physicians in the United States, and 80,000 Indian physicians in the United States. And if you take Pakistani and Indian physician out of this health system will collapse. One of the Congressman Keith Allison, so he said that if you take Pakistani physician out of the health system, this health system will collapse, because they are working at different level, at higher level and administrator level. And of course, so we do this health fair every year where we provide flu vaccine, we provide free physical exam, we check their blood pressure, we check their blood sugar. And this year we also gave COVID vaccine and the glaucoma screening. So guess who helps me? All my students, all my externs. So they help me, and we do this community service. Community service is very important. Keep in mind, whatever you do in your life, keep community service part of your mission. Yeah, this is we're doing. This you can see my team at the bottom. Like this is all these the externs and college students, maybe a few of them. And yeah, here we're doing this glaucoma screening. This is one of my residents. So residents also come and help us during these health drives. And we also give them certificate that these were the volunteers, like high school, high school and college students. So we give them like this certificate of volunteer service. Civic engagement that I've been talking right now. So I think civic engagement means that we have to be involved in the community. We have to understand your rights, and you have to be part of political process of this country. That is very important. Wherever you are, you have to be part of this civic engagement. Otherwise, you're going to be sitting on the back seat and doing nothing. So either you had to be on the table or you had to be on the menu. So you want to be on the table, not on the menu. And to be on the table, you had to be involved. You had to be involved in this political process. So when my externs come, so they get involved. So recently I was appointed as a chair of a New American Advisory Commission of Bucks County. The government, the Bucks County government appointed me. So this picture, when I was there, I accepted that chairmanship. So we involve first and second generation American. So what are their concerns and how can we help them? And immigrants as well. So these are my student. I think at the bottom is like when we have with President Biden, with my students, we have this Zoom like here. So President Biden and all my externs in our boardroom. So we were on that Zoom and they watched it. And here's the Congressman Brian Fitzpatrick on the right bottom. He always help us like any visa issues when sometimes when they get residency, then visa issue starts. So this is the man. This is my man, Congressman Brian Fitzpatrick, and he helped us and in the visa issues. So yeah. So my externs and students, wherever I go, they go. So any programs come in between, so I take them with me. And I met Congressman when I came to United States. So I think first time I met Congressman after 10 years of in my United States. So now my extern, they come here and they can meet Congressmen. So that is kind of a blessing, and they can learn from them. So this is so I think this civic engagement is very, very important. And actually, I'm running for a little position on May 17th. So it's a Democratic State Committee. So my election is on 17. So, and my students are helping me too for my campaign. So. what's going so, sorry, this went backward now. It's okay. All right. Along with that, of course, we should have extracurricular activities. So the extracurricular activities are very important. When you go for the interview, they're going to ask you, what are your extracurricular, anywhere you go, any kind of interview, residency or anyone. So you must have your extracurricular activity because they want well-balanced people. They have some other activities, not only like work or studying, you must have. And whatever your activity is, you should know in and out of that activity, of your hobby. You cannot go and tell them, I fly kite, and you don't know anything about the kite. They're going to ask you about it. And when you tell something, you should have a full knowledge of your hobby. You cannot make it up. So always never lie. That's what I want to say. Always be truthful. What you do, tell them. Because like this is a human nature. Like somebody lying, you can tell it. You can tell like this person is not telling us the truth. So my hobby is a kite flying. You see my kites here. So my externs, they go and they fly kites with me. So these kites are like these kites are 16 feet. They're very big, huge kites. It's a fun to fly them. And when we get a chance, and my students, we go and we have little fun. So we have life. In this picture, we have also, I think, residents and externs and all the students. So my externs come from all over the world. They come from like Pakistan, India, China, Africa, and you name it. So I have we take like from everywhere when they come. I try to help everyone. I'm from Pakistan, so but I help everyone whoever comes to me. I help them. That's my mission, to help every human being whatever I can. So this is my hobby, and actually I started flying kite when I was 2-3 years old. So actually my mother actually supported me to fly kite. My father did not. So of course, when you fly kite in Pakistan, they consider it, oh, you are not a good student. And so, but that hobby was my hobby. So when in the United States, when I found these big kites, my goodness, I got so happy. I got these kites, and when I go and fly, a lot of people have not seen even these kites, even in the United States. So they're humongous, and when they fly, it's so beautiful. When you hold them, they're very heavy. You have to have gloves and special kind of thread, and my student and I, we enjoy when you go flying kite. I think the flying kite was not kite flying is good enough, but we can't fly in winter. Then I said, why not have a drone? So we got a drone, and this is your flying drone actually inside my office. They're my externs, and we're flying inside my office. So you can fly. So Dr. Drone, go and see patient with the drone. So then this is like I took a picture from the drone. This is where I live, my development. So my students, we fly this drone together as well. So this kind of work, so we work hard and we play hard. That's what it is. Also, we play cricket. There's a tournament, and my team won. So this is yeah. So these are all my externs. This tall guy, he's from I think Russia somewhere. So they all, and here we're enjoying our food at the picnic. We also celebrate. I think like when we are here, we celebrate everything. Somebody's birthday comes up, we celebrate. Whoever, office staff and student, if we find it, we celebrate it. So that is it's a different program we did. So this the top picture is our an office annual dinner, and then these other pictures are some birthdays, and this is it's a Halloween there when my externs were at Halloween, so we get costume for everyone. We celebrate everything, whatever comes on our way, every holiday. So this is like how to get into externship program. So I have Anila Dean, her name is written. Actually, she was talking on these slides, but I will talk myself. So when you're from you're international graduate, not only for international graduate, I mean like international graduate, that also mean the people who are from United States, they go to other schools outside the country, Caribbean or other countries. So then they become like a foreign school graduate. So we also help them as well. So people from coming from other country and people from United States, doctor from United States and from other countries. So who have done their schooling outside the country. So we help them because they also need a LOR, letter of reference. So that's why we have this program. So every year we get hundreds of applications, then we do our own screening process. So we take from everywhere. I have written here mainly from Pakistan, but they come from everywhere. I'm from Rawalpindi Medical University, that's why I wrote it. But if you look into my students, they're from everywhere. They're like, in this picture on the top, you can see from Africa, from like Middle East, from China, from everywhere. So we take everywhere. From when they come to us, we take at merit base, and so we get, I think, hundreds of applications. Then we had to screen them as well. And certain criteria we use. As I said before, the preferably graduate within past 5 years, and at least we have to pass one step, step one. So we don't like to have somebody who has not passed any step and they apply for externship. So at least they have passed step one. And we put some criteria for the score. Now the step one is just pass and fail. And like step two, the CK, they should have at least 220 plus, because I have doctor came to me less than 220 and they got residency, and it can happen, but it also depends on you. As I said earlier, score is very important, but sometimes like I have extern, they're so good, the score is little low, then of course I have to help them out of the way, and because they're so good, and I know they're going to perform very well. So but as long as they're fresh graduate, the score is a little low, but 220, 230 is the best score, like at least 230 plus. If you're in CK, if you have a 230 and plus, then you're good, because that is a lot of programs, they have filter of 230. The one program I'm affiliated with, they filter at 230 in CK, the step two. So if score is less than that, they don't even consider. But if I know someone and they have done externship with me and they're good and really prove themselves, so we can help them. We talk to the program directors and tell them. So the electives, I said, the students from anywhere, they can come and do like elective with us. And we send a letter of acceptance, and so that can help them to get visa as well. The expectation, what we expect from these externs, they have to be punctual and regular. And when I say punctual, so that means punctual. So if our meeting started like 9 o'clock and they show up 9 o'clock, they're already late. They're not in time. So in time, you have to be, I teach my all extents. So you had to be there 10 minutes earlier. You had to be there. If you just come at 9 and you think, oh, 9 o'clock meeting start, you just walk in at 9 o'clock. So you are late. So this is these things I consider. I have some extern, like they will come late, all the time come late. Then they have some kind of excuse why they're coming late. I don't take it. I don't take it. You had to be punctual. If you're punctual and regular, that's a big plus. Somebody is very good, and not punctual. That does not matter anything to me. Somebody is borderline, but very punctual, hardworking. I will like that person better than the one who has book of knowledge in his brain. So, of course, clinical knowledge, we consider like to a level that I discussed. Then attitude, very important. That we want people here like who have good attitude, they have and pleasant personality, they can work and get along with other people. So this is not only medical field, this is everywhere in your life. Wherever you work, you have to be team player and compassionate and good communication skills. So that is, of course, you have to communicate with the patient, communicate with other people. So I have accent, a lot of other people have accent, but we still have to learn certain things, how to communicate. If you have an accent, then just speak slowly. Don't speak fast. So this kind of thing we teach our students, because if you have an accent and you're speaking so fast, nobody will understand you. So this is our like email address if somebody wants to apply. So just make a picture of this for externship, for volunteer work, for your electives, if you're a medical student. So you can email us your request and we will take. We ask all these things, your resume, your USMLE, like a score and reports, and your visa status, and if you need accommodation or not, and what month you want to come. So all these things, we look into that. And we normally get like anywhere between 6 to 8 extern every month. We have 8 exam rooms, so we can accommodate up to 8. But we have residents, they come here too. So these extern and medical students, they work along with those residents when the residents are here. And accommodation is very important. So we have accommodation for boys and girls, and we provide them. And also there's it's a furnished area, and it is affordable and very accessible, especially for the girls. We have very close to the office, the walking distance. And actually Varda is sitting next to me. She's my extern, and she just
hello everyone.
and she just live very in our accommodation next to, very close to our office, and she just walks in. Yeah, just a picture of our this like our accommodation for the girls. And it's actually it's a one room efficiency. You can, but all these kitchen, there are 3 beds, and it's this nice little place. And this is for the boys. The boys is a little bit away. They have to 45 minutes in the bus, but this is very nice, beautiful little house. So I call it a Farooq Palace. So my name is Farooq. So they live in a palace. It's a beautiful accommodation we have provided them. So when they come here, so first day is the day of orientation when they come. So Anila Dean, she's my administrator, and she gives them all the orientation, what are the expectations, and that we tell what our office culture is and what are the requirement. And we talk about the American culture, the people who are coming from other countries, and how to approach to the patient, how to access to the electronic medical record, and then what you can do in the exam room, what you can't, and what are the requirements for letter of reference. And they also have to do PowerPoint presentation. So that is part of the rotation, because during PowerPoint presentation, actually they have to make a presentation and they have to present. So they learn the presentation skills, and they work with each other. and everybody does a great job. And we teach them how to present. And this is our boardroom. So here they're presenting, and this was a big group. So they're externs and residents. So doing PowerPoint presentation. Now, of course, we have a fee structure for this rotation, but it is affordable. We provide accommodation, and Anila is my administrator. Then she can talk to those people who need. Some people don't need accommodation. They're from this area. They can have their own. That is very good. So, but it is affordable. So this is our information. Like anybody interested in, like medical student interested in doing electives, they can. And foreign medical graduates or graduate, and anybody from United States has been foreign medical graduate, anybody. So they can contact us. Volunteer work. We also like volunteer, like high school, college students, if they want to do volunteer work with us. So this is our like contact is my cell phone, Anila's cell phone, and our email and office address. I think that's all. Or now, anybody has any question, I'll be more than happy to answer. And then I have to start my office. I work on Saturdays, so my office is, we are sitting downstairs, and our office is already like, my office staff is here. So we're gonna be 3-4 hours in the office today. Yes, anybody has any question?
Yeah, thank you so much for that session. I think we all found your career really inspiring, how much you've been able to accomplish. So my name's Robin. I'm an operations director for TeleShadowing. I'm currently working on my PhD at Johns Hopkins, and I'll be running the Q&A session today. Our first question is, what inspired you to pursue internal medicine, and what was your experience as an internal medicine resident like?
So internal medicine rotation is basically we're a primary care physician. So internal, we are not family practice. Family practice is a little bit different. Family practice, they see children, they see like pregnant women and all those. So internal medicine is, we see adults 16 and above, and we are specialized in internal medicine. We treat all those heart conditions like asthma, endocrine problem, thyroid issues. So we like even from sore throat, minor issues to even complicated issues. So that's what internal medicine is when they come here. So they learn all these things. So we don't see children under age 16, and we don't see pregnant women. So that what internal medicine is. But rest of all the complicated patient, like 16 to 100 plus, we can see.
So is that what drew you to the field, the variety of things that you get to see and treat?
Yes, so it's a variety. As I discussed earlier, so we not only office practice, we also see patients in the nursing homes as well. So they get very extensive exposure working here at Knights Medical Hospital, office, and nursing home. So they they see almost like the whole system of medicine. How does it work in the United States? So
what do you think is, what do you think is the most challenging and rewarding aspect of working in internal medicine?
Okay, so the thing is like, I'm a private practitioner. So wherever you work, you have a challenge. So you not find any place where you can work without challenge. Even working in the hospital, you're gonna have challenge. Working in the private practice, you have a challenge. But if you have a passion, so you can work everywhere. So here in private practice internal medicine, our challenges, we treat all kinds of patients, but sometimes our challenges come of the insurances. Certain thing we have to deal with the insurance companies. If I want to do something, so need permission from the insurance company. So that is, and I want to do something, insurance companies not letting me do it, not paying for it. So that become our biggest challenge. So where we have to, like, we are representing our patients and we try to do what they need. So that is dealing with those insurance companies, especially in the private practice, because we had to deal ourselves with all these things. So that is our biggest challenge. But nowadays, because of this COVID-19, so the other challenges are like having staffing. So those are the one. And but from academically, so we like challenges. We like to see a patient, we like to see them and treat them. So those are the good challenges when we like diagnose something and save somebody's life, and they make us, we feel so good. One of my patients was like 35 years old, so came to me, has a minor issue. So we did a blood test was normal. So we decided, okay, let's do one more test. We did one more test. In here we found a thyroid cancer. And if I have not done that test, but we thought, my students and I thought, okay, let's do this test. So then we treated the cancer. He's now like almost 10, 15 years. And that patient comes to my office and tells everyone, oh, you guys saved my life. You guys saved my life. So see, this is the gratification we get. So along with other challenges we have that upset us. But so when we have this kind of patients, we help them and they feel good, and we feel good too.
Which patient care setting do you enjoy the most? Outpatient, inpatient, hospital?
That is like a very good question. You just came to, and actually I like all of them because that's why I'm doing all of them. So wherever you go, they have different kind of perspective. So doing primary care, I personally like it because I'm dealing with the community. I'm dealing with the people who need your help. So I enjoy a lot this private practice, and it's my private practice. I have no boss except my wife. So this is also give me a lot of things that I can do. I can see patients for free because it's my practice, right? So sometimes we do, like if somebody needs help, we help them. And but if this practice was owned by the hospital, so I can do it. For the employer, you can't do free things, but here we do. So that's why we develop relation with the community, and the community knows you, and they trust you. So that's why I like this primary care, like office practice. Although office practice is a little bit difficult to do because you have to do everything by yourself. So on the other hand, I like nursing homes too, because they're elderly people, and you go there, they're so happy to see you, and you help them a little bit, they're so happy, and they become like really attached with you, and they admire you. When I go there, hey, Dr. Farooq, you look so nice. So these things are like, and you feel good. So you're helping them, and some of them give you like motherly love, like, oh, so you feel like those things. After my mother passed away, so now I feel more when I like see like 90 years old. So when they show their affection to me, so I feel so good. So and that reminds me of my mother. So I treat them like my mother. Some patient I get so much connected with them, when something happens to them, then I cry too. So these are the things like, so nursing home patients are like, on the other hand, like they're elderly population, they need you, and families don't come and visit them, there's so many social things. And so when they see their like providers, healthcare providers, and they're taking care of them, and they need that help. So I like that. My students, when they go with me, they get so happy, and so I enjoy. So then the hospital practice that I do, I like it because that keep me updated, because you do advancing in the hospital, and so you stay like your knowledge stay really fresh by doing the hospital practice along with that. So this is a traditional practice the doctor used to do, but I'm still doing it. The nowadays doctor either do hospital practice or they do office practice. So I'm doing like all of them, like including office, nursing home, and hospital. But probably I always like two-tone things. That means I like multiple things to doing at a time. So so that is my personality. So you don't put your eggs in one basket. So
Probably really keeps it interesting for you, something different all the time. So you briefly mentioned the COVID-19 pandemic. Can you tell us what some of the unique challenges are in the different outpatient, inpatient hospital settings?
I mean, challenge started when the pandemic started. Of course, at that time we have nothing. I remember when I diagnosed my first patient of COVID-19. So patient calls you, and we got instruction for Department of Health. If patient calls you, they have a cold and fever, tell them just stay home, don't go out. Department of Health will go their house and take the swab and find out they have COVID or not. So that's where it started. And then, of course, after that, and only Department of Health was doing tests going to the patient's home. Then I was thinking, why don't we have other tests people can just drive through? Here, the drive-through test came. So we were very happy. So now the patient was going through. Then the biggest challenge starts when the COVID-19 vaccination comes out. That was our biggest challenge. The people, this is a mRNA vaccine. It's not a new technology, but people think it's a new technology. So it was more than 10 years old technology we've been using for skin cancer, melanoma. But the people did not think this is new. They thought this is a microchip in it, there's some robots in it. And you know, the United States spent $10 billion, and all the expertise of the world got together, and everything was, the process went a little faster, but no step was missed. FDA needs 6 weeks of safety data. They provided 3 months, I think 8 weeks of safety data. FDA needs 3,000 patient data for 3,000 patients safety data, and they did 30,000. So no step was missed. This was our biggest challenge. This was, and to convincing people, so get vaccinated. And at that time, I did a lot of Zoom conferences with the different communities, especially African-American community, Black people, because what happened with them in the past, we are ashamed of that, the syphilis, because what happened in the past years ago, the syphilis, they were tested for the syphilis. They got if the Black person get the syphilis, they will not treat, they will look into different stages of the syphilis and the patient dies. So they have all those things, distrust with the government. So minorities, the other like immigrant communities, they have distrust. So we did a lot of work on that. I joined different organizations. We did different Zoom meetings, and we went to different places, and we taught them. So that was the biggest challenge we have. And then we were successful. So majority of the people got vaccination. Then it became mandatory, of course. People ask me, it's my body. It's my right, right? So that's what everybody thinks. So in one Zoom meeting, one person said, oh, I'm PhD, I'm this and that. So this is my body, so I have right. I said, okay, I understand you have right, it's your body. But if your action is affecting other people, then it's not your right. If you get COVID-19 infection now and you give to your mother and she dies with it, then what? So it's not only your body, it's your responsibility now to protect other people. It's not you, we have to protect other people. That's why it is mandatory. People have to understand like the limits of their rights as well. When your action is affecting other people, then it's not you, then it's other people as well. So when I gave him this answer, I said, okay, so it's that's what can happen with other people if you don't get vaccination, then what? So he kept quiet. He did not argue with me at all after that. And but I mean, of course, in the United States, we have human rights and everything is there. I know that, but there are certain limits as well. Your action should not affect anybody else. Then it is not your right. Then it's other person's right. So this was our biggest challenge, was a vaccination. So that's why I started these campaigns you saw. I'm going to like a nursing home, going to the different places, churches, mosques, worship places, going to shopping center. So, and telling them that I got myself, I put on the Facebook and everywhere in the media, I got it. So people, and my mission was the doctor should give this vaccination because the people trust their doctors more rather than the government places. So I did myself. So I convinced people. So we still have a challenge a little bit, but I was in the nursing home 2 days ago and one patient refused. She said, no, she does not want vaccination. And but luckily, thank God, a lot of people got it.
It's such a miracle of modern science. It's really a shame that people aren't embracing it. Is there anything that's really surprised you about your career in medicine that was different from your expectations going in as a medical student?
Yeah. When I was like medical school, I didn't think about what I'm doing right now. So I was just like a regular student. I was a top student, you know that? I was top student from the bottom. so that does not mean anything. So then I started, like I came to United States. So what I'm doing right now, I didn't even think about that. So everybody, what I'm saying is everybody has something hidden inside them and you have to bring it out. So what I'm doing it, I never thought about that. I'm going to be doing all this. I'm helping the community and helping the foreign medical graduates. So that was the way I started my private practice. When I was starting my private practice, so everybody like was surprised, you're starting private practice. It is so hard. How are you going to do it? So there's so much competition. I said, there's going to be competition wherever you go. So I'm going to start my practice. So I started and I got successful. So you had to provide something different from other people. Then you'll be successful. The competition is going to be there always. So that was like, that was surprise. Like people ask me, did you do any research when you're opening office? How many doctors are here and what's the population? I said, no research. There are doctors next door. There's so many doctors there. I said, no research. I'm going to start. But I provided the thing the other doctors are not providing. So my practice got successful. So these are the things, like you get surprises in your life, but you have to persistent, hardworking, and helping people, you will be successful.
Is there any single case that stands out to you as particularly interesting or challenging that you'd like to share with us?
I think I was talking about that case already, like the cancer case. That is like, there's so many cases, but that was very, very interesting case. Like that patient came to me, one of the blood tests was abnormal for the thyroid. I repeated that test, that came up normal. So I could have stopped over there, but the blood test is normal, just that's okay now. There's nothing, maybe by chance. So we did like another test. We checked the neck ultrasound and we found a little mass over there. So then we started from there and we found the thyroid cancer, 35 years old, thyroid cancer. and that was treatable. So we could have missed that very easily. And because he has no symptom, no nothing, blood was normal. So that was amazing. Like then he got treatment. He's perfectly fine. And whenever he comes there, he's smiling. He's telling this story to my students. And he's telling, oh, Dr. Farooq saved my life. That's not true. God saved your life. So, but the things are like, so that was a very interesting and inspiring case. And there's so many things that I have interesting. And but one of the interesting thing, like a lot of my patients inspire me. One of my patients is 100 years old now. We celebrated her birthday in my office. So that was an interesting case. She came in the nursing home. She was 91 years old, and she was on the chair, and she was not even talking. She has tremors. She's like, we thought she's gonna die. And she was not eating anything. So I said, what's wrong with her? She came from the hospital, so she has infection. I said, oh, because probably she's now have dementia, and she's wheelchair bound now. No, she was in the jerry chair, like bed. She was on that, not communicating. So I said, what's wrong with this? So some of the nurses said, we should start hospice care. She's dying. I said, okay, let me call the family. I called the family and I asked them, so, what's wrong with your mother? So we don't know, but tell me what medication she was taking. And they told me that she was taking Xanax. Xanax is like a benzodiazepine. So, okay, she was taking Xanax for how long? For 20 years. I said, okay, my God. So let's start her on Xanax. So I started her on Xanax. Next day, she woke up. Literally, she woke up. She's alert. She's awake. And after I think a couple of months, I send her home. Now she comes to my office. So she wants her Xanax. I give her Xanax. You're gonna get Xanax, and that saved her life. Now she turned 100 years old. For last 8-9 years, she's getting Xanax from me, and it's a kind of like a controlled substance, but her body is used to it, and she was 91 years old. Why shall I stop it? So that was amazing. She could have died there in few days if I have not found that one, and everybody will think, oh, that she has dementia, she got worse and she died. Even the family will not know it. Nobody will know it. So that was so interesting. Now she comes here and she's perfect. She she's in the wheelchair. So she will come and she first thing will ask, my Xanax, give me refill on it too. Give me 3 refill. I'll give you 3 refill. Go ahead, no problem. So that kind of things, that is very, very interesting and interesting case.
It is. And I think that's a really good lesson to all of us, that you need to really listen to your instincts as a doctor and your patients when you think there might still be something that you can do for them. So our next question is, how do you personally manage constructive feedback?
How do I what?
How do you personally manage constructive criticism and feedback that you receive from people?
Say again, I can't hear that.
How do you personally manage constructive criticism and feedback that you receive?
From the patients?
Or from colleagues or anyone?
So that is, I think, very important thing. And I always take it positive. And I'll always learn from that and improve myself. And the patient tell me something, I tell, thank you for telling me. And even somebody tell me something, I improve right away. That's the way I'm going to improve. If nobody tells me, say, Dr. Farooq, you are the top doctor. I'm top doctor. I was nominated so many times. I don't need to, I'm Philadelphia Magazine top doctor. Or you're top doctor, but that, not to be a top doctor, you have to do things right. And if you have something, I always learn from the other people. I learn. If somebody tell me this thing is not right or criticize, I improve right away. I say them thank you for telling me this thing. So we improve. So I always take criticism as a positive, and just improve yourself. Some people are very stubborn, so if somebody criticizes them, so they just become angry and they don't change. And those people will not be successful. So always take your criticism as a positive thing, because somebody's actually telling me that this thing is not, I'm not doing something right. It's better than somebody keep on telling me you are the top doctor, you are the best doctor. So because that's the way I can stay best doctor, if I know what's wrong with me and I can improve myself.
So along the same theme of continuing to improve, what resources do you use to stay up to date on new treatment methods for your patients?
Treatment method for?
Yeah, what do you use to stay up to date on new trends in medicine?
Up to date, okay. So as internists, we have to have pass our internal medicine. We had to recertify every 10 years. So for your knowledge wise, so to stay up to date. So I just took my 10-year recertification actually last week. So it's not required, but it is nice to do that, because then you keep yourself updated. But now there's so many things, like we use technology. We have one app called Up to Date. So it's for the doctors. They have all the new like treatment and all recommendations you can find from there. So we go and we have like phone in our hand. We just go and research right away and find out the things. Even when I was taking my exam, we were allowed to use that app in my exam. So the technology is becoming so important nowadays. So even you can use them in recertification exam. So always like we try to keep ourselves updated. If we have anything doubt, we just research right away. My students there, they tell them, okay, find it out. So that helps for our patients.
Do you have any book recommendations for our students?
It all depends like what category they are, what kind of student they are. But there's no like a specific book I can recommend for anyone. And it's all depends what they're doing and what their needs are. So they have to find those books accordingly.
So we have a question that just came in from one of our students. What is the one thing that you would want to change in the IMG's attitude, or what is the most common mistake an IMG makes, which should be avoided from day one?
Tell me again, what's the question?
What is the one thing that you would want to change in an internal medicine doctor's attitude, or what's the one mistake that an internal medicine doctor should avoid from day one?
About the attitude? Of course, like positive attitude. And the thing is, your attitude with the patient should be very pleasant. When you see patient, you're a doctor, you make them feel that you are different as well. So if you develop that kind of attitude and relation, patient will love you. They will love to come to you. They will not say, oh, I'm going to Dr. Farooq's office. My goodness, I have to go there again. Sorry, my phone. So you have to have an attitude that people love coming to see you. So I think that is what I do, that what I teach my students as well. So like when the patient comes, just make them feel happy. They feel good, because if you talk to them in a nice way, they feel good already. So if you already treated them a lot. So if you just doctor-patient relation simple, that is not enough. My patient, they come, they hug me, we sit, we talk, we make fun of each other. I treat them, and and that's the way they are, and they think I'm their friend and I'm their friend. So that kind of attitude we have to have. It's not we're a very good doctor, we're a top doctor and we have chip on the shoulder. I don't like any chip on the shoulder. We're all human beings, and everybody need due respect. So that's what I meant. Make a friendly relationship with the patient. Consider them your family. The way you treat your family, they're your family. They're coming to you for help.
So for our very last question, you're clearly very busy. You work in all of these different clinical settings and you run this mentorship program. How do you manage your work-life balance?
That's a very good question. That was asked to me when I was running for this office right now. How are you going to manage this? My answer was very simple. If you want your things get done, go to the busy person. I repeat it. If you want your things get done, go to the busy person. That's what I can say, my answer to your question. So I manage my time. I don't take my homework. I don't take my work to my home. So I manage my time and I do things. I mean, let's say, and that's the only thing. Like if somebody's not busy, there's reason they're not busy. I have my personal experience. So people who are busy, I call them and ask them, I need this thing, and that will be done right away. I call to a person who is not busy, or okay, we'll let you know tomorrow, this and that, blah, blah, blah. So that is the difference between the busy person and non-busy person. Busy person, there's a reason he's busy, because he's doing things. So that's what I try to do, and I do my things. I try to do things right away. That's my thing. If I postpone them, I don't like to postponing thing. Do right away. Phone. This phone is so important. Why? I can tell you one little example. I answer my call right away. When I get a phone call, I answer. By answering one call, if I don't answer that call, I might be losing an opportunity. So a lot of my students do that. When I call them, they don't answer. They answer me like after 1 hour. They are your losers. If somebody don't answer your call, they're losers. One day I was sitting, 4 o'clock, I got a call on my cell phone. I saw one of my friends is calling me. I said, okay, I was busy. I can call him. I can call him later on. So then I answered the call. When I answered the call, he said, okay, I have an opening for the position for the residency. You have anyone? I need right now. I said, really? Okay. So from the other phone, I call another student and he answered me right away. I put both phones together and let them talk. And after half an hour, he has an interview and he got that job. Now, if I have not answered that call, I was a loser right away. If that student have not answered the call, he could not have that job. So that's why, can you hold on one second? You can go up, see patient. And so that's why I tell my students, when somebody call you, answer the call. And if you don't answer, you might be losing big opportunity. By just answering my call, I got so many opportunities. So this is a thing of a busy person. Why the busy person? So my advice is always when you're a student, always look into your call, always answer your call. You can drop the call after, okay, I'm sorry, I'm busy, but at least you don't know what opportunity you're gonna get. So yeah, that was my answer to your question, busy and how to manage.
Well, thank you so much for everything today and giving us your time.
So my pleasure, and thank you so much for giving me this opportunity. And anybody need any help, everything is there. And thank you and good luck, everyone. Take care.
And thank you very much, Dr. Farooq. We really appreciate you taking the time out of time to answer all of our questions and taking the time out of your day to mentor us.
Oh, it's my
I
pleasure.
like-
And it's my, yes.
Yeah, no.
Yes.
I was just going to say, I'd love everyone to please give a warm thank you to Dr. Farooq in the chat box for his incredibly informative session. Thank you very much.
Thank you. Take care, everyone. Have a nice day. Take care.
Now we're going to conduct our closing session with our quiz and our future session dates. The link to the quiz for this session is live now. You will need a 70% or more or higher to pass it and receive certification. Now on to our next session dates. These dates will be posted through our social media outlets. Be sure to follow us at TeleShadowing. Our next session will be Saturday, May 7th at 10 a.m. Eastern Standard Time with our physician mentoring us in neurosurgery. Thank you so much to everyone for attending today's session. We hope to see you in upcoming sessions. This concludes this week's TeleShadowing session.